Hello again, guys. Sorry for the second video, but this is our supplement to peripheral and spinal mechanisms of pain control. Again, by myself and my partner, Monica Matoka. Monica has already given you some examples of managing musculoskeletal neuropathic pain, but I'm now going to introduce positional release therapy as a means of manual therapy to decrease pain. According to Howell et al., the theory behind PRT is that it has an impact on the myostatic reflex, which in turn decreases aberrant neural discharge and will interrupt the pain spasm cycle. PRT is also found to relax and reset muscle spindles that are dysfunctional due to the myostatic reflex arc and also by decreasing gamma gains of hypoxic muscles. This type of therapy is non-invasive and puts a trigger point of a muscle in a position of least tension and optimal function. According to David Butler in his book titled The Sensitive Nervous System, many trigger points may be abnormal impulse generating sites, or AIGS, located in the cutaneous nerves, but they are struggling with their relationship to fascia, muscle, and postural demands. In 2012, Wong, in his article Strain Counterstrain, stated that neuromuscular activity is mediated by muscle spindles and local circulation or inflammatory reactions influenced by the sympathetic nervous system. So in essence, the muscle fibers surrounding these trigger points and hotspots of pain need to be in a position of comfort and need to unwind in order to function properly and help to decrease pain felt by the patient. Motor imagery. Graded motor imagery is a rehab process used to treat pain and movement problems related to altered nervous systems by increasing the brain in measured and monitored steps, which will also increase in difficulty as progress is made. There are 3 different steps as seen on the slide. Actually, they're treatment techniques, and they include left-right discrimination training, motor imagery exercises, and mirror therapy. These techniques need to be delivered sequentially. The left-right discrimination is thought to be that patients in chronic pain lose the ability to differentiate where the pain actually is. So training them to know what side it is on is important to the recovery process. And graded motor imagery is also recommended for patients in the chronic pain state. Motor imagery exercises are essentially being able to move without moving. So imagining yourself moving a limb or body part that would typically be in pain, but imagining it moving in a non-painful way. So again, this is an imagery technique. So imagining yourself stepping up to the batter's box and hitting a home run and then getting into the batter's box and actually doing it. Mirror therapy is if you were to take your left hand behind a mirror and right hand in front of the mirror, you can trick your brain into believing that the reflection of your right hand in the mirror is actually your left hand. So you are now exercising your left hand in the brain, particularly if you start to move your right hand. Again, I repeat, all 3 of these exercises or steps need to be done sequentially.